if it's Medicaid, it would be capped for the individual. They would only pay so much money. But if it's something like private pay, it could become a fee-for-service type of billing arrangement.
So through Medicaid, a person can get assistance in covering these costs. Let's say if a person who's is not able to pay the fees that you've identified, what type of support or resources they can tap in order to pay for nursing home care?
Dottie had described some assisted living resource limits. Generally speaking, and I do mean generally because I find that the final determinant is the local Department of Social Services. They review that application, and they are the ones who determine what allowances can be made, say for you have a spouse in the community, you may be paying for an additional medical insurance policy, and those allowances are determined by the local Department of Social Services. So I always tell individuals you need to get your final answer from them, but generally speaking, the income is not necessarily capped low or anything like that. I believe you could earn $3,000 a month in retirement income and still qualify for the long-term care medical assistance, provided your resources or your assets do not exceed $2,500. And again, we're speaking generally, and I would let the Department of Social Services answer that. But they also need to qualify on a clinical or medical level. And the doctor has to certify they need that care in the first place. This would be for Medicare and Medicaid. And again, with the Medicaid, there is the financial assessment and qualifying.
So what are the typical types of illnesses that would require a person to need nursing home care? I know Alzheimer's, we're familiar with that.
Even Alzheimer's is not necessarily nursing home level.
Okay.
It could be a combination of cognitive, like the Alzheimer's, with physical limitations, or severe Alzheimer's where the individual, I'm sorry, is not capable of doing anything for themselves such as feeding themselves or certainly dressing themselves and certainly keeping themselves safe. That's a major thing too. But there might be many medical things that if a person is physically limited or compromised, they could well end up in a nursing facility. They could hopefully go through the rehab procedure and say a broken hip and then be walking again and be all right. So and then there are some things like multiple sclerosis that will be an increasingly debilitating situation. All these individuals we see inside the nursing homes, we see the elderly primarily, but more and more we are seeing a younger population in there too, with diseases like multiple sclerosis, automobile accidents. Lupus seems to affect people too. And it's needing a certain level of nursing care and oversight. And when it comes to things like your insurance paying, and certainly Medicare for individuals who have Medicare, you need a very skilled level of nursing.
That seems to be the major distinguishing factor, the amount of assistance you need and the amount of assistance you need in getting around and doing things for yourself. Your mobility level seems to be a major factor in whether you need nursing home care facility compared to assisted living. I think you're more able to do things for yourself and take care of yourself and be safe. So
the mobility is a very strong factor, but there are a number of people in assisted living that have a lot of mobility challenges. It's the combination, and what I consider the real deciding thing is needing that nursing staff there 24/7.
Right.
That determines they have to They have to stay in a nursing home.
Okay, well, that's important. That's what we want to do today is really identify those distinguishing factors, because what led to the need for this discussion was the fact that there tends to be confusion and misunderstanding about, one versus the other. So, ladies, you're doing an exceptional job in distinguishing these two very, very important areas of service for seniors. Anything else?
I just wanted to point out that with the levels of care that Jeannie had mentioned, levels 1, 2, and 3, that there are level 3 people in assisted living facilities, as long as the staff can meet their needs. Of course, this would be determined by the Office of Healthcare Quality, whether or not they would be licensed for level 1, 2, or 3.
Can you give me an example of level 1, 2, and 3, so I can get so our viewers can get a feel for?
Well, level 1 would of course require less care than what a level 3 would. Level 2 is medium, and level 3 would be heavy care, totally bed bound. And we do have individuals in assisted living facilities that are complete bed bound, but we have staff that's there to take care of their needs. And trust me, they are doing a wonderful job throughout Prince George's County in taking care of seniors that are aging in place, as we say, in the community, in a community setting, rather than going into a nursing facility.
Well, we thank those caregivers, don't we?
Yes, we do.
Yeah,
And
great.
may I say one other major difference is that assisted living such as Dottie's and most of Carol's too are literally in home-like settings, and a nursing home has a more institutional face almost in all cases. And in Prince George's County, I'd have to say they all have a fairly institutional countenance.
Okay. Now, you mentioned earlier that there are a few facilities in the Bowie area. How can our viewers get additional information on exactly where these facilities are?
Well, actually, we have quite a few in the Bowie area. This seemed to be the area where people flock, and I think it's because these are where your middle-aged individuals have their parents that have come to live with them, and they feel that they can no longer care for them but would like them closer to them. So they place them in the facilities, in the assisted living facilities, and we do have a number of facilities in the Bowie area. If you would like information on the specific facilities in the Bowie area, an individual can contact our office, the Administration on Aging, 301-265-8450. We would be happy to share that information with you.
Very good.
And may I say that you can also access the information online.
Okay.
The Office of Healthcare Quality has a list of their licensee. They have a licensee directory, and I do believe it may cross over to the Maryland Healthcare Commission website now, where if you will go to the Office of Healthcare Quality's website, and you can just Google that name, it will lead you to the list of all the assisted living in the state, broken down by county. And there is also a way that it will take you further into another website that will actually let you look at their latest inspection report. And that's for assisted living. It's a fairly new feature. As far as nursing homes go, you can go to www.medicare.gov, and they have a feature called Nursing Home Compare. That will bring up every nursing home in the country if you want to see that. Or you can break that down by county too. You can even search by your zip code for proximity to where you live. And that also shows in general terms how they did, how they are. They now have a new 5-star rating, which they will show consumers to use as a tool.